right. So today my client has intermittent hip pain. That's been brought on by a couple of accidents whenever she was in her 20s. All right, so today we're going to go through some assessments. We're going to be checking things throughout your whole body, not just around your hips. You may feel some pain for a couple of days afterwards. You may not, but so that's just things to be aware of. But there's other things that may be of great benefit to. You may feel things that might get better that you didn't even realize that you had issues with. Just so you know, that does happen sometimes. All right, so we're going to be doing a little bit of palpation also, some range of motion. The palpation we'll be doing is throughout the whole body. Two places that are a little more sensitive is around the sacrum. So we'll be palpating your sacrum all the way down to the tailbone or your coccyx, and then also your pubic bone right here, just on the superior part of it. That's all right with you?
Yes.
Okay, all right, let's get started. So first what I'll get you to do is I'll get you to go onto your toes and then just drop down onto your heels. All right, did you feel anything different there? Okay, so now what I'll get you to do is imagine that there's an imaginary fence right here, and just start bringing your leg up and over the fence and then back around to the same side. Okay, and then do the same thing with the other leg. Okay, and now we're going to do shoulder circumduction. So then do the same thing, but with your arm, and bring it back. Okay, same thing with the other side. Okay, and then back this way. Okay, and then I'm just going to get you to face the back wall. I'm just going to hold your hips. I'm just going to hold your hips, and I'll get you to turn to the one side and then turn to the other. Okay, that's good. Okay, and then I'll get you to face me again. And then if you want to turn your neck to the one side, turn your neck to the other. Okay, and then I'll just get you to go into global flexion, it's called. So I'll get you to curl your fingers forward, your wrists, arm, shoulders, neck, and then just your hips too, and try to go as small as you can without getting your heels off the floor. Okay, and how's that feel? Any pain, discomfort?
No.
Okay, so then you can go back up, and now go into extension. So the same thing, but the opposite, just extending your hands, wrists, shoulders, neck, back, and hips. And how's that feel? Any pain, discomfort there? Okay, all right. All right, so I'll get you to just rotate your hips to the one side. Okay, and then rotate to the other. Okay, and then now just rotating your head from one side to the other. Okay, that's good. Then I'll just get you to lay down face up. All right, so I'm just going to bring you up a little bit. So I'm just going to be pulling a little bit of traction on your legs. A little bit of restriction there. And some restriction there on that right side, eh? Any pain?
No.
Easier going on that left side, eh? I'll just get you scooched down just a little bit so your feet are close to the edge. All right. Yeah, definitely feel that restriction in the right side. So just right at the hip, right? Okay, do you feel that right side? Just below the hip there? It's a little bit tighter there. Okay, so now I'll just get you to scooch up, just so you're closer to the edge of the table. Okay, perfect. Just gonna grab your arms. Never hurt your arms before? No shoulder injuries before?
No shoulder injuries, no.
Okay. Okay. And then I'm just gonna do a little bit of traction on your neck. Let me know if you feel anything unusual, any pain. 1, 2, 3, 4, 6, 7, 1, 2, 3, 'That T3, right about there. That's still a little tender. Okay. All right. All right. So we're going to tap a few different places throughout your body, looking for your sclerotomes. So it's part of your metameres, and you should feel the same feeling on each side. But just let me know if you feel a discrepancy or if you feel any pain. Okay.
Okay.
L2, same. L3,
Same.
L4.
Same.
Okay, we're just going to skip the L5. We're going to do that one after. So S1.
Same.
And S2.
Same.
Okay, so now I'll get you to turn face down.
Okay.
And you can actually probably give me those. I'm just going to feel if they feel similar. Yeah, they're both dry. Okay, so now we're going to tap your ischial tuberosity, which is the your sits bone. So you're all right with that?
Yep.
Okay, right there. Okay, no pain there.
Nope.
And right there.
Feels fine.
Okay, and it feels the same.
Yep.
All right. All right, so now I'll get you to turn back face up. And we're gonna check some pulse points. And then also, so you haven't ever noticed that, do you have any varicose veins at all?
No.
Okay, perfect. Okay, start off with temporal. And now we're looking for symmetry with the pulse points. Okay. Facial. Same. Got it. Okay, easily. I'll just get you to bring your arms up a little bit. Okay. Middle. Okay, radial. Okay, nice and strong. Okay, great. Okay, now femoral. weaker this side. Okay, help the heel. Okay, posterior tibial. Okay, and dorsal pubis. All right, so now we're gonna do Mitchell's testing. Okay, so first, I'm just gonna have a look at your posture. Ears seem even, shoulders seem even. Okay, and then if you face the back wall there. Okay, so I'm just gonna check your spine here. Neutral. Okay, all good. And then if you go into flexion, just bring your chin to your chest. And that is all good. And if you look up. Okay, so that's all good. Okay, and then if you lift your arms up a little bit. Okay, so your ilium's a little high on the right. Okay, then I'll get you to bend forward. Okay, and then back up. Just gonna make sure I'm right at the right spot. Okay, right there, same thing. Okay, and then back up. All right. Up, slip on the right. And then right deep sulcus. Okay, and then weight that down. Okay, and then I will just double check your anterior pelvic tilt. Right there, so that is good. Then if you face the other direction. Okay, so that one is straight, so that has posterior pelvic tilt. Okay. Okay, and then I'm just gonna anchor your pelvis here, and I'll just get you to rotate to the one side. Okay, and then rotate to the other. Okay, and then your neck, and to the other. All right, so now I'll get you to just have a seat on the table. We'll do the same thing there. Okay, so just look at your spine first. Okay. And then if you bend your head forward. Okay, and then if you look up at the ceiling. Okay, and that's good. We'll look at ilium. Okay, high on the right. Okay, and then if you bend forward. Okay, up slip on the right, back up. Okay, deep sulcus on the right. Okay, all right, just write that down. All right, so now I'll just get you to lay down face down. Okay. Now check your spine again. Okay, good. And then if you look up to the ceiling, or as high as you can. Okay, that's all good. Your ilium. A little high on the right. Sulcus is still on the right. Okay, now I'm just going to palpate your sacrum. Okay, right there. Okay, that is ILA straight. And then if you go into the Sphinx pose, so pushing yourself up with your arms, okay, and deep respiratory angle is on the right, okay, and then you can go back down, look for some mutation. Okay, so yours is counter-nutated. Okay, yeah. All right, let's write that down, counter-mutation. Okay, let's just see. Okay, the pressure seems even right there. Okay, so now I'm just going to palpate your pubic tubercle right there. Okay, so a little higher on the left side. Okay, and right there, I'll just get you to landmark that, so just keep your finger right there. And I'm just going to measure your in flare and out flare. $14. $14.5. Okay, that's good. Now, let's just check your leg length. Okay, right there. Okay, so 76. And 76. All right, now we're gonna check passive range of motion. Okay, so I'll just get you to relax your legs. And tissue stretch right there. Then okay, so now we're gonna check your passive range of motion with your hips and your legs. And so I'll just get you to relax your legs. And tissue stretch right there, no pain, discomfort. Okay, and then just check your knee right away. Okay, no pain, discomfort there. No pain, discomfort. And a little bit of restricted right there. No pain and discomfort though?
Nope.
Okay, so same thing with this one. Okay, no pain and discomfort. No pain and discomfort there. And right there, a little bit tissue stretch. And same thing right there, a little tight on this one too, eh?
Mm-hmm.
Both on the outside. Then let's just do this one here. So I'll let you just drop your leg. And that's your leg relaxed right there.
Mm-hmm.
Okay, let's try it from here. Okay. And then the other side. So both pretty high, eh? Okay, and now I'll get you to just hold on to your knee. Okay, and then you can drop your leg. And just relax your leg. Okay, now I'll get you to hold on to that leg. Okay, tissue stretch right there. Okay, and then you can just relax that leg. All right, so now if you want to turn face down, okay, so again, just relax your leg. Okay. All right. Range seems to be pretty good. Just a few spots, eh? So now we're gonna do the straight leg raise for a special test, just to see what's going on around the hip. To see if it's muscle or if it's sciatic nerve involvement. Any pain or discomfort there?
Yep.
Okay, so we're at about 70. So just let me know whenever it starts going away.
Yep.
Right there. Okay, now I'm just gonna dorsiflex your ankle. Any pain there?
Down
Okay.
the back of the leg.
Down the back of the leg? Not in the back though? You're not getting any back pain right there?
No.
And nothing on the other side?
No.
Okay. So that's telling me that your hamstrings are tight and the sciatic nerve is involved. Okay, so right there. Right there too? Same thing?
Yeah.
Same pain?
Yeah.
Okay. I'm just going to dorsiflex your ankle. Same thing?
Mm-hmm.
Going down?
Yeah.
Okay. Now I'm just going to try to go a little bit more. Any pain in your lower back?
No.
No? Okay. Nothing on the other side either, eh?
No.
Okay, so that's it for the leg raise test. All right, so what we found so far, the clinical impression would be that your sacrum would be misaligned. And the reason for that is since we did find discrepancies when doing the testing for the sacrum, and it is consistent with your symptoms. And also the what that can do essentially, and why you're feeling it in other parts of your body, is because it does affect the tensegrity of your body. It distorts it, and then your body has to compensate going outwards from the sacrum. Make sense?
Mm-hmm.
All right, so now we're going to do a global treatment, so GOT, general osteopathic treatment for the lower body. Okay, and this is a global one. So we're going to start off by rotating your leg to the one side, 5 to 7 times. And then go the other way. Okay, and now I'm going to be dropping your leg. So I'm just going to start off not too high for the first time. Okay, not too bad?
Yep.
Okay, so I'm going to drop your leg a few more times. Not too bad? Didn't feel any pain or anything anywhere?
No.
2, 3, 5, 2, 3. It's a little more awkward going this direction, eh?
I can feel it clicking
Mm-hmm.
this way.
Okay, so now I'm going to drop your leg. And 5. All right. So now what we'll do is we'll just do a little bit of mobilization for your hips. Okay, so what I'll get you to do, so I'll get you to bring your body towards me, but with about 10% energy. So I'm going to bring, just rotate towards me. 1, 2, 3, 4, 5. Okay. And then one more time. 1, 2, 3, 4, 5. Okay. And one more time. 1, 2, 3, 4, 5. Okay. So that's the out flare, or treat essentially for in flare, so we're moving it outwards. So now what I'll get you to do is the same thing, but you're going to be trying to bring your other side of your hip towards me. 1, 2, 3, 4, 5. Okay. And one more time. 2, 5. Okay. And then one more time. 3, 4, 5. All right. We're going to do the same thing on this side. Try to bring you towards me. 10%. Perfect. 5. Okay. One more time. Okay. One more time. 4, 5. All right. Okay, so now we'll do muscle energy technique. All right, so I'm just going to bring you to the feather barrier. So we'll start off with the one side. Right there, I'll get you to go 10% down. 2, 3, 8, 9, 10. Okay. Do the other side. Right there. Okay, same thing. 3, 4, 5, 6, 8, 9, 10. That's good. All right, so then I'm just going to do the same thing with your knee here. Right there. So bring your knee down. 1, 2, 3, 4, 8, 9, 10. Okay. Okay, right there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I'll just get you to keep your foot there, and I'll get you to try to dorsiflex. So bringing your toes to your nose. 10. Okay, and I'm just going to do the other foot. Okay, so same thing. Try to dorsiflex. 1, 4, 8, 9, 10. Okay, so then we're going to do inwards rotation. Okay, so right there's feather barrier. So if you want to rotate your leg internally, 10. Okay, and then feather barrier on this side, right there. 10. Okay. And right there, moving inwards, 2, 4, 8, 9, 10. Okay, and outwards, right there. 9, 10. Okay. Right there, and then I'm just going to put my hands right here. So if you try to close your knees together, but only 10%, 2, 4, 5, 6, 8, 9, 10. Okay. And then the same thing down here. 4, 8, 9, 10. Then upwards. 10. Okay, just gonna, sorry about that. Okay, so I'm just gonna let your foot drop a little bit. Okay, no pain there?
No.
Okay, so then I'll just get you to bring your knee into my hand. 1, 2, 4, 8, 9, 10. Okay, and then the other side. Good.
Mm-hmm.
Okay, 10%. 1, 2, 4, 5, 8, 9, 10. All right. Then if you want to turn face down, all right. So right there, if you bring your knee down, 2, 3, 6, 7, 8, 9, 10. Good. And right there, bring your ankle outwards, or I mean, push against my hand. 3, 9, 10. Okay, so same thing this side, right there. 2, 3, 6, 7, 8, 10. Okay, and then right there, moving your foot out against my hand. 5, 6, 7, 9, 10. All right. So I'm just going to bring your legs to the point where I can feel. Your sacrum is kind of opening up. Okay, right there. All right, so now I'll get you to look to the right. is I'm just going to put a gentle pressure against your sacrum, and then I'll get you to just take some nice big deep breaths, all right?
Mm-hmm.
Okay, right there, some nice big deep breaths. Okay, and just do that a couple more times. So I'm just applying pressure along the sacrum, and then with a little bit of a downwards pressure on the very superior part of the sacrum. Feel that move a little bit. Okay, and then just one more time. Don't feel any pain or anything?
No.
Okay, so now I'll just get you to go back to neutral. So head back to neutral. I'm going to find that depressed inferior angle again. And now I'll get you to do that same thing again. So to go into extension, so bring your body into that Sphinx pose. Okay, and then back down. And then try that one more time. Just want to make sure. All right, perfect. Which will correct the counter nutation. Okay, you ready?
Mm-hmm.
Okay, so I'm just gonna go right to the base, not the base, but the just the top of the sacrum right here. And I'm just gonna put a little bit of pressure right there. Then I'm just gonna move your leg out a little bit, just till I feel a little bit of movement. Okay, and now with the same thing as a while ago, I'll just get you to bring about 10% strength into my hand. Okay, do that 2 more times. Okay, and then one more time. Push it against my hand. Okay, and I'm just going to hold that there for 20 to 30 seconds. Okay, so let's just reassess. Yeah, it definitely came up. So that's good. Perfect. So everything that we've done, we've double checked again, and everything seems to be good now. So we're not getting any more discrepancies. So you might feel something tomorrow. Maybe, maybe not, but don't be surprised if you do feel a little bit of achiness as your body adjusts over the next couple days. That sound good?
You bet.
All right.